Well, the DA wants to sell alcohol on school premises in the Western Cape on a special events basis, saying it aims to raise funds that could be reinvested into the school system. The opposition ANC says the move will have adverse effects in the regional community, already struggling with a serious substance and alcohol abuse. Well, this comes as SANCA Drug Awareness Week wraps up, with focus now on some very worrying stats in the country. According to the South African Community Epidemiology Network stats, the number of people admitted for treatment in 2017 spiked to over 10,000 from over 8,000 in 2016. 80 centers were recorded in that study. Another alarming stat emerged from the report is that 80% of South Africa's male youth deaths are alcohol related, and that drug consumption is twice the world norm. Well, to help us understand what drives people to abuse substances is counselling psychologist Jeremy Bayer. Joins us on the desk now. Good afternoon, Jeremy, and welcome to the SABC News Desk.
Thank you for having me.
Well, huge controversy on whether alcohol should be sold on school premises, and we don't want to politicize it further and have it turn into political hot potato yet again. Just tell us what's in the best interest of learners so that we don't exacerbate the problem of underage drinking that we know is there already.
Well, first I must say this is an absolutely terrible idea. In fact, I don't know if the word terrible does it justice. What is in the best interest of learners? Well, a school is a place where we're supposed to do the opposite of that, where we're supposed to talk about the dangers of substance abuse, early underage drinking. So it's completely counterintuitive as to what schools are supposed to be about. That's number one. Firstly, as a hypothetical scenario, you could have a 15-year-old in the school, okay? The 15-year-old speaks to his 20-year-old brother, and he says to his 20-year-old brother, come to the school, buy drinks, then meet me in the bathroom, and then he smuggles the drinks into his bag. The 15-year-old then gives the drinks to his friends, and they go drink at break. So where there's a will, there's a way, because in this country, kids are drinking as young as 12, and there are multiple unlicensed places to get liquor.
And it is a very likely scenario that you're painting for us, because it's the lived reality that we have to accept. Children as young as 10, in fact, are drinking. Now, in the same report, males over the age of 20 are the biggest abusers of alcohol. Now, I just want to focus on our male youth for a second there. When would the high risk points be in a boy child's life? Would it be when we're looking at major transitions, maybe the times when he enters high school or university perhaps?
I'd say probably around 15 to 22. And probably because, number one, this issue of men don't speak about their issues. The stigma of if you say you're not coping, then you're not man enough. So how do they then cope? With alcohol. That's number one. Two, peer pressure. All my mates are drinking, and then drinking is the thing to do, so they start getting into it as well. That's number two. Three, the fact that a lot of these kids live in stressful societies, gang-related societies. In order for you to get into the gang, you've got to do a certain thing, and in this case, it could be go smuggle drinks for us in your school and then come and give it to us. So that could be one way of gang initiation. And just generally that you know, that men don't speak about it, and then mental health is seen as, oh, you weak, or you don't do that thing. So couple all that together with the environments that they live in, and you've got a hotbed of a drinking problem.
Right.
You see what I'm saying?
What are some of the driving factors behind this problem of underage children, underage drinking rather, within the South African context, Jeremy?
So numerous. Firstly, the fact that it's so easy to get alcohol or drugs, you know, unlicensed, whether it's shebeens or
accessibility.
Easy accessibility. Poverty within these communities, and not always poverty is it's the factor, because it's in middle and upper class areas as well. Gang initiation, or getting into gangs. So you go steal those drinks, and once you do that, you get into the gang. That's another one. A lack of mental health resources, and so the way to cope with, say, depression or bipolar or anxiety is to drink. So the knock-on effects of that. Then sort of, if you were to link the drinking with gender-based violence, for example, the husband, or whether it's a high school kid or a husband, He drinks to cope with his stresses because he's been told you don't talk about your stress. He then goes and gets drunk, comes home and beats up on his wife. So we also, the problem is that we're not focusing on the far-reaching effect of substance abuse.
And you've actually preempted my next question, because I want us to explore this link between substance and alcohol abuse and criminality we see playing out in our societies, especially domestic violence.
So
does one exacerbate the other?
Yeah, of course it exacerbates the other. 60% of crimes in this country are substance abuse related. So of course one exacerbates the other. You know, someone comes and hijacks you, and they're doing it, or they come and steal something in order to get their fix, or they you know, to get your drugs, to feed the habit. I need to steal a TV, I need to steal a radio, or whatever it is, to feed my habit. So it's that kind of chicken and egg scenario. Yeah, it's and I just generally think it's not regulated properly. Why is it that our sort of drunk driving or accidents keep going up every year? So you've got to look at the way it's managed, the fact that can the cops be trusted? In other words, our law enforcement is not good enough. So there's so many things that are related to this, not to mention the fact that there's not enough child mental health services, which means they get into drinking a lot sooner.
Very quickly, we are out of time. How high is the risk that if drug and alcohol abuse is not controlled at adolescent age, at school level, could this mutate into a long-term addiction as the child in question enters into the workspace or adulthood?
Absolutely it could. Absolutely it could. If there are risk factors such as violent home life, the kid has other mental illnesses such as depression, anxiety, or that kind of thing, and there's little support, then absolutely it can. And remember, at that stage it can start with seeking the mood swing, and ultimately it can result in substance dependence. So with little support and living in sort of a violent environment, it can absolutely do that, yes.
All right, we long ago reached a point in the country where schools, employers, etc. Need to have clear substance abuse policies which make provision for the referral of persons or persons in question to treatment centres before disciplinary action is actually taken, Jeremy. What are some of the factors we should be looking at so that these policies, especially at school level, are implemented successfully?
Well, number one, the schools have to have either social workers, counsellors, or psychologists, and a lot of them don't. So a lot of the strategies are punitive. So the first thing is, if the moment they see a problem, then they've got to support them. That means the school has to call the parents in, and that there needs to be counselling within the schools. That's number one. Whether if it's in companies, which you may also be referring to, in a lot of those situations, before it gets to warnings, companies, and I strongly implore this, have to have employee wellness providers, because anyone can have a mental illness, whether it's addiction, depression, whatever the case may be, and it's all treatable. So I strongly implore that companies have employee wellness providers. And then once that then happens, if that still doesn't work, then you take steps from there. But that's what I suggest.
All right, thank you, Jeremy Bayer, our counselling psychologist, joining us on the desk this afternoon. Thank you for sharing those invaluable insights with us. We do appreciate your time.